So the term brain tumour encompasses a wide variety of diagnoses, some of which are benign, slow-growing tumours, some of which are fast-growing cancerous tumours. And we have to tailor the treatment to the surgery depending on what we think it is, and that will be guided by the imaging. There are some situations where tumours may either be situated in a part of the brain where surgery isn't safe, or they have such a slow-growing or benign appearing tumour that actually in their lifetime that tumour is unlikely to even cause any issues. So sometimes in that scenario, we'd look for a more watch and wait situation where we just monitor. If we need to intervene, then again, how I intervene and what surgery you require will depend very much on the size of the tumour and its location within the brain. You have to take into account that your brain is a very important part of your body and you're using it every minute of every day. There are some parts of the brain where you have function, very important functions such as speech or eyesight, movement, for instance. And surgery in and around those areas is very complex, and we have to tailor that surgery so that, most importantly, I don't make you worse, but also importantly that we remove as much of that tumour as possible so that we can enjoy a good result from surgery. So the term brain tumour surgery obviously fills us with dread, and you always think the worst case scenario, but in fact, brain tumour surgery is nearly always really safe and goes really, really well. It's only in a minority of cases where we have problems. The thing with brain tumour surgery is that if there is a problem, the side effects, the complication can be quite significant. So it's very important that we have a chance to explore each of those risks before we go ahead with surgery. And the risk of surgery will depend, again, very much on where the tumour is located, how big the tumour is, and also what we think this type of tumour is. Is it growing rapidly and the risk of causing a complication is slightly higher? This is something that we can discuss with you when we see each other in clinic. There are the straightforward risks of any operation, such as the risks of being in hospital, like deep vein thrombosis and chest infections, pulmonary embolism, and so forth. And then we have to worry specifically about surgery. There's a risk of an issue with the wound, which again, very rarely the case because the scalp heals very, very quickly. There's a small risk of causing seizures with any type of brain surgery. So quite often you won't be able to drive immediately after surgery, and that's something you have to check with us before we go ahead with any procedure. And then, as I say, it depends on where the tumour is in the brain, but this is a very detailed discussion that we'd always have at the time of a consultation. So preparation for brain surgery takes there's several ways to answer that question. One aspect is to prepare yourself mentally and physically. So being as fit as you possibly can for surgery. Having an anaesthetic is a bit like taking a brisk walk. So you have to make sure that you're as fit as you can be. Eating healthily, not smoking, drinking in moderation, but also being mentally prepared, being in a positive mindset going into the treatment. That is often helped by us having a good discussion to work out exactly your operation is going to involve and the recovery period so that you're well prepared so that you can plan it in your mind. Other parts of preparation for surgery will be checking in with my anaesthetist beforehand. So they will see you and make sure that from a medical perspective, your heart, your lung health is all optimized before going down to theatre. There may also be some tests that we need to arrange as well, like some brain scans, sometimes some brain scans to get a bit more information about your brain tumour, or it may be if we're treating other condition, just to work out exactly whereabouts in the brain or whereabouts in the skull I need to make my incision into the bone. There may be some other tests like an ECG and blood test that we'd arrange for you also. So everyone's recovery following surgery is different, but for sure, with brain tumour surgery, we look to get you up and about, get you out of bed as quickly as possible. We know that lying in bed for a long period of time is definitely not the right thing to do. In fact, after brain surgery, we will wake you up straight away from your anaesthetic so that we can assess how you are and how well you are. If there's any problems at all, we may need to arrange a scan just to check that everything went well during surgery. Immediately after surgery, for the first 12 hours or so at least, you'll be in a high dependency unit or in a ITU, depending on what operation you've had done. That will allow us to closely observe your immediate recovery following surgery and make sure there weren't any problems developing over the first 12 hours, which are probably the highest risk period during the recovery. Following them, we'll be wanting to get you up and about, and we have a team of physiotherapists and occupational therapists, in some cases speech and language therapists, to help mobilize and get you going and get you back to normal life. But most patients should expect to be in hospital for a day or two after surgery, sometimes a little bit longer if you need a longer period of time to recover. And there are some patients who will have complex rehabilitation needs, and we have on-site rehabilitation who can see you and help with that process. And there are some cases of cervical surgery, the brain tumours in locations within the brain which may require a few weeks of recovery before going home. After surgery, you will need potentially close follow-up with scans and clinical follow-up, or you might need some other treatment. It depends on what type of tumour you have. If you have a tumour that originates from within the brain, what we call a glioma, which in fact represents most of the tumours which end up having surgery, then we'll have an idea after the operation, usually within about a week or so, of the grade of the tumour. This gives us an indication of the likelihood of this tumour growing back. And in many scenarios, what I'd want to do is to refer you on to see one of the oncologists to discuss this result with them, because sometimes we need to employ treatments like radiotherapy and chemotherapy to delay the time from surgery to the tumour recurring. There are some situations, though, with more slow-growing or benign tumours, where surgery is all that is required. In that situation, often we would arrange a plan for follow-up scans and follow-up appointments to monitor you. And then hopefully this will continue for the foreseeable future. In terms of can the tumour recur after surgery, this will depend on the type of tumour that you have had treated. But in most cases, there will be a period of monitoring for at least 5 to 10 years after surgery, even for the most benign tumours.